Hey guys, it's Dr. Schulz. It is just after 11 on Saturday night. I'm practicing my social distancing by not going out. Um, just putting together a video for Sunday morning. Wanted to touch briefly on a couple of things. And the big one is really going to be PPE and cardiac arrest. This is based off some questions we've gotten about this, and a couple of calls have been run that we want to make sure you guys are protecting yourselves when we're dealing with cardiac arrest. So we haven't changed really any of the protocols on cardiac arrest, with the exception of the fact that we're not intubating patients who the iGel or BVM is working for. But the big thing on cardiac arrest is we need to be protected and need to use PPE if there's any possibility this is a COVID patient. So it's really hard to tell, right? Obviously, the patient's not going to give you that information, but if we have information that is indicating a fever, a cough, other concerning symptoms, recent hospitalization for pneumonia, stuff like that, we probably want to consider that a positive and protect ourselves appropriately. I would say on most medical cardiac arrests, you probably need to come through the door thinking, I'm not going to get all the information and I need to protect myself. And so I need to make sure I bring my PPE. I probably want to have one person, at least one or two people, geared up in PPE, ready to take care of the patient, because we certainly don't want to delay getting on the chest and doing chest compressions in order to stop, say, okay, well, we don't know, let's put PPE on. So if you can get geared up ahead of time in the PPE, that may be a valuable thing going in. Make sure you bring it with you. So why am I making a big deal about cardiac arrest? Well, the big thing is we're actually really overly cautious in some ways about how we interpret the CDC guidelines for PPE. Now, they do recommend exactly what we're doing: gloves, eye protection, mask, and gowns. But there's language in there that, and the way the risk assessment works is the gowns on every case is a little bit of an abundance of caution. Most cases most patients we see are, even without the gown, they would still be a low risk exposure. And actually we use the exposure matrix for known COVID patients. Most of our patients aren't actually known COVID. Many that get screened as negative for COVID-19. So we're being cautious and trying to make sure that we kind of be abundantly cautious, making sure that you guys are protected. But in reality, there's a couple of things where the gowns really are essential. And that's anytime you may nebulize droplets. Remember, this is a droplet transmission. I'm worried about virus in specifically respiratory secretions. And so in a cardiac arrest or respiratory arrest, the patient's not coughing or breathing, so they're not aerosolizing any of these droplets on their own. But as soon as we start pushing on their chest or we start bagging, and when you release the bag, the air comes out that exhaust port in the BVM, then you're letting some of these droplets, which may have live virus in them, into the air where they can contaminate you. So it's really important that if you have a suspected COVID-19, and unfortunately, like I said, we may have to kind of consider on most medical arrests that there's a good chance it could be. Right? If I get some information, especially if I hear things about fever or pneumonias or those kind of things, sure, we got to make sure, those are kind of a slam dunk. They help. But most medical arrests, we probably need to at least consider it and make sure that we're ready to take care of it. Again, the 6-foot bubble still pretty much applies. I would recommend anybody on a cardiac arrest where we're aerosolizing a bunch of stuff, anybody who's even coming into the room probably needs to have a mask on. But if you're the pumper chauffeur and you're running back and forth to the apparatus for equipment, you probably don't need a gown, right? The captain or the supervisor who's standing back, keeping times and managing the scene, probably don't need a gown. I would put a mask on, glasses, gloves. The guys on the floor working the arrest, especially those up near the airway, which is going to be your CPR guys, as well as your airway management guys, your people bagging, need to be in the full PPE. All right, there's like I said, there's exceptions to the PPE stuff from CDC where we can, it could still a low risk even if you don't have certain things. In a CPR call, there isn't any exceptions. If you're working a code and it's somebody who we're concerned about COVID-19 on, it's going to be medium risk at best if you start leaving off pieces of PPE. So make sure you're ready to take care of these patients. Make sure that you've got your PPE available and that you protect yourselves. All right. That's really all I got. Wanted to just kind of get some stuff out about cardiac arrest. But I hope you guys are having a good weekend. Those on shift, have a great shift. And everybody just be careful. And I'll see you guys around. By the way, I'll throw one more thing out there. All these videos, or many of these videos, are coming from questions that we're getting from the field. So if you guys have questions, you have things you want to see in a video answered, go ahead and send me an email, kevin.schulz, SCHULZ, I'm in the global directory, at houstontx.gov. I'll get with Dr. Stouters, and one of us or one of the other docs will put a video together for you. But yeah, we're just want to make sure we try and, there's a lot of stuff going on, and I know there's not a lot of information. A lot of it changes regularly. So yeah, we'd love to put a video together. If you guys have questions, just shoot them our way. All right, have a great shift. Be careful.